We see a lot of patients for TMJ problems, jaw joint problems. TMJ is something that a lot of patients are experiencing, and it's not something that a lot of physicians or dentists are really dealing with because it kind of falls into a gap between dentistry and medicine. So, TMJ problems will come from two things. It could either be pain that's coming from within the joint. So if the joint anatomically is breaking down, you're going to have some problems. Or it can be coming from pain that's with the muscles that work the jaw and are around that joint. The two things are interrelated because if you have muscle pain, you have muscle tension. And if you have muscle tension, it's pulling on the disc and the anatomy of the joint, creating inflammation, which will create that breakdown over time. When we see a patient for a TMJ problem, our first step is to figure out where that muscle tension is coming from. And it could be a couple different things. It could be sleep apnea. It could be a bite that's off. It also can be systemic disease that's causing some sort of muscle tension or side effects from medication. So we want to make sure we're understanding what's happening and then we're treating the joint. We have technologies here to take basically like a CAT scan of the joint so we know what's going on. Once we know what's going on, we know how to treat it. So really one of the key things, and if it's a bite problem, is to use appliances to make sure that the jaw is balanced. Okay, so if your joint is breaking down, it's like, we use the analogy, it's like a table in a restaurant. So if the legs of the table aren't all touching the floor, there's going to be a wobble. That wobble creates the muscle tension because your muscles are trying to hold that jaw in a stable place. Now, if the jaw is breaking down, if that joint is breaking down, that's why we need the x-ray. That means one of the legs of the table is changing. So we have to constantly stay ahead of that changing leg to get the muscles to relax. That's why we use appliances. It's not good enough just to use the appliance. We have to see the patient regularly to be balancing that appliance and adjusting that appliance so we get ahead of the moving, wobbling table. Once we get the muscles relaxed, then the joint can heal.